Oh,
Yeah.
yeah, that's a good. I'm not sure.
I'm not sure how clear it's going to come in. But not the case.
I can see myself.
That's what you
So
need
this
to.
is gonna be hard for you, isn't it?
Well,
it's good.
But if you
I'm
set it
just
up.
gonna, yeah. I'll just
Yeah,
hold
you
it
can
here.
even do that, like set it there.
I don't care. I can hold it here.
Is it turned on now? Okay. Oh,
You're on.
Yep. Okay, here we go.
That way, if you move around, I'll follow you. I'll just set it here so that if you move around, I'll follow you.
Right, exactly. That sounds good. Talk about the visitors. Let's just stop there for a minute. I cannot stress that enough. The visitors really keep them to a limit because what I have seen happen, and this is no joke, visitors start coming, especially once they're home, like because there's nobody there to really protect you. Visitors start coming, and you're gonna be uncomfortable nursing the baby when people are there. So you're not gonna be focusing on you and baby. And guess what? Then it's gonna be like you're gonna be like, I think I'll just stick a bottle in her mouth, and you're gonna have a hard time getting the breastfeeding really up and going. And that is something I just really stress. Like, just take that time for you and baby, so that the breastfeeding can be a successful thing. Because that first week is very crucial to just be to be nursing a lot and not to be interrupted while nursing, not be made feel like pressure because somebody might be there watching or you feel like they're watching, not that they really are, but you just be like, especially for a first time mom. It's like this is still really awkward. I'm not used to this and don't feel like doing it when somebody's here. So really protect that time. That's huge. Be honest with people who ask if they can come to see the baby. If you're too tired to rest, or if someone is staying too long, say so. It's hard, but it really is. And there are days, and that's where you, as the daddy and as the protector of your home, protect that, and you can be the voice to people. Say, hey, I would really appreciate if you would text me before you come, and then I'll let you know if it's a good time or not. Because Judy's going to say, oh yeah, sure, come over. She will. Like it'll be hard for her to say no, and that's where you're going to be, need to be the protector, and just have people go through you. That's yeah. Husbands need to be protectors of their wife and baby at this time. 9. Do not allow people with colds, stuffy noses, or any other symptoms of a possible virus or infection into your home for several weeks. Both mother and baby are extremely vulnerable at this time because the body is trying to heal, so its energy and resources are needed for healing instead of fighting a bug. Wives will be grateful to husbands. It takes a lot of energy to say no. So if hubbies can do that, it takes pressure off mom so she can rest and heal. Number 10, Kegel exercises. Strengthen muscles that surround openings to vagina and give support to bladder and uterus. Again, you know what the Kegel exercises are. So after the baby, um, start doing them again. More difficult after delivery, but do them as best you can. They will get easier as the days go by. Kegels will prevent uterine prolapse, which is dropping of the uterus, and bladder control problems. Contraction right here.
So same thing.
Use different positions. Hands and knees, like all fours. You can get down. You can do. That's a good one. That's a really good one. Yes, you will love that one. And that's a good position to get to your back as well, to give you like an all over back massage, but down your hips. Like you're gonna. This is something that we do too, like the hip squeeze. Just pushing in on the hips, like to that relieves pressure. Right here is a good spot to like put pressure on, not too hard, but just enough to put pressure on there. The shoulders, focusing on the shoulders, and right in here, like with the massage oils. Feet is always a really good thing. The hands just like do light strokes. And again, we could use the massage oil. this we had talked about in one of the classes, but just to refresh, um, doing this like really relieves, like it's the gate theory where you, if you like the hands and the feet and the lips, as pain is coming, and if you do these kinds of things to the hands, even holding hands, all that kind of stuff, stops the like this you, it kind of stops the pain. Like it doesn't, it's not going to take it away, but it will reduce what you're feeling as you just massage the hands and the feet, and of course kissing, always a good thing.
Yeah, who's gonna want to do that?
I know, you can think that, but I know, yeah, just those kinds of things. And focus on your, and of course we're quiet while you're having a contraction. We are quiet.
This would help her like turn right as far as like face down, like this.
And like this, really, if you have back labor, takes the pressure off the back to be on your like to get everything front. Like if you have back labor, to move things like away from the back is good. It takes the pressure off. So that's a really good position.
So that wouldn't necessarily turn her if her face is up.
No, not these. These are just kind of normal things. There's other things that we can do, other exercises that are a little more intense, and we see that like if she would be face up.
How would you know that?
The only way they would know if they would know how to feel.
They can feel that?
They can, because if they don't feel the butt, if they feel the feet and not the butt,
Clearly, I can't really
Yeah.
trust these ladies.
Well, yeah. That's what I would ask. If you end up having a consultation with this other OB, ask her those questions. How good is she at feeling the position of the baby? Like how thorough is she? I think she is. From what I've seen, she really knows. I couldn't believe that she was an OB. I thought she was a midwife because she was so knowledgeable and so all that natural. I loved working with her because everything that I wanted to do, she could go ahead. I love it. I love that you're doing that. But sometimes I get looks at like, seriously, why are you doing
Well,
that?
yeah, that's kind of how it was. Like with,
Yeah.
at the doctor there, like even mentioning the chiropractor, she looked at me like you're crazy. Like why would you do that for anything?
Bizarre. That's just bizarre.
Who is that doctor?
I forget her name. I have to again refresh my memory on her name. I did ask Katie the other day, and I again forget what it was. But she signed one of my papers, and I really liked her a lot.
Okay. Cool.
Yeah, she was one that.
Now, would we give her a birth plan if we would go with her, or would we still take it and we would give it to her?
Yeah. You would give me one and give her one. You would go for her, yeah. And you can take one and tape it on the wall in the room as well, so the nurses can see it and stuff.
Yeah, I really hope she's available though.
Yeah, I think you would love. At least just at least if you just want to meet with her and just kind of see if you feel a difference, would help you. That way you know that you have tried your best, like you have looked at options and you know that you're making the best choice. Because if you would meet with her, you would be like, oh my word, I can't believe the difference. Or you might be like, oh, well, I don't really see a difference. But that way you would know, because you would have considered your options. And it's not huge, because I know it's important for you that your insurance is going to cover where you are. So Women's and Babies is a good place for you to be versus a birth center. So I would say then just go with a really good option of a care provider. Yeah. Okay, contractions over. Okay, now we are going to go through. This is just, things in here are for symbolic to what some things are and some things aren't. Okay, pull things out of the basket and let's talk about each thing that's in there. And why would you want to have your water bottle with you in bed? To stay hydrated and keep the milk flowing. Make sure you drink your water so that your milk can produce more. Yeah. Next thing. That book. Because guess what? You're going to be spending a lot of your time breastfeeding. You're going to have questions. And that has an index. You can just open it up, and in the back, like right inside, any question you have, it'll talk. So we'll call it the breastfeeding Bible, because it just answers all your questions. And you can just look at where it is. It's in there somewhere. An index, I could say store nipples. Look at, and it'll show you what pages that's on, and just read. It's not really a book that you just like read from page to page, page through, because it's a big book, but it just covers everything. So keep that with you. Keep that with you.
I have one. It's called the Central Guide to Breastfeeding.
Okay.
This, like I said, this was on my registry, so I could still get it. I have like a coupon for everything on my registry, so I'll probably just
Unless you can get it at the library or something too. And just, but I know I just got Rosa just this evening, because I called her today. I was like, can I have my book back for tonight? But she's still using it as well. Like she just picks it up and will. Yeah, she said it has really, really helped her. Okay, the next thing. And what would that mean?
Stay in bed.
Stay in bed. Stay in bed. Just have it being a relaxing, fun time in bed. Yep. It's a picture. What is the picture of? Breakfast in bed. Breakfast in bed.
Because our thing is every Sunday we make pancakes, so I'm like, Sunday, make the pancakes in bed.
Yeah, that's good. Yeah, the person that's taking care of you, have them serve you breakfast in bed, or even just your meals. Like, you can stay in bed. Let that be the time that people will just really serve you. I mean, if you want more than just breakfast in bed, have them bring lunch to you in bed, or even dinner, or whatever. It's you. It's your time. But definitely breakfast.
You can massage my shoulders, please. So how close are they by now? So that's getting close now. So it's going out pretty painful. Now, are you still like at home by now? Or are you at the, when should you be at the hospital?
Yeah. Remember the 411, 4 minutes apart, timing the contractions from the beginning of one contraction to the beginning of the next contraction. Not from the end of one to the beginning of from the beginning of one to the beginning of the next one. 4 minutes apart, lasting a minute for 1 hour.
And then you said that's the point where you want to go.
That's the point when you're considering, okay, I think we should probably head to the hospital. And especially if you're having a bloody show. Especially if you're having a bloody show. But sometimes, like, even if you're not having a bloody show yet. And that's really being consistent. Like, they're not moving all over the place. They're being consistent every 4 minutes or less. Lasting a minute. We actually look, it's almost more important to look at the length of the contraction, like lasting a minute to a minute and a half, rather than are they 4 or 5 or 6 minutes apart. The length of one, because the length is telling you what your body's really doing. The length is telling you, oh, wow, the cervix is really, so, because if your contraction keeps going on and on and on, that's when it's really producing something.
And I'm assuming somebody would be keeping track of this for me, because I can't. I was like,
You
I will not be able to sit here.
No, you're not that. So you are just gonna relax. You're not gonna, like, you're just laboring and relaxing. Your job is to relax as much as possible. Remember, keep your shoulders dropped. Shake everything out. Just relax. Don't stiffen up. Don't tighten up. Just concentrate on relaxing. your shoulders would tense. Dig into the chin, touch your shoulders, and just say, drop the shoulders. Remember, we also relax because oh, you're relaxing. Give specifics. Drop the shoulders. The next contraction, let's start using some of these things. These are the big guns. Remember, the hot compresses are the big guns. We bring them out toward the end because they really take the edge off of these contractions. Okay, the next thing in the basket. Oh, right. Yes, that is healthy food. Keep healthy food by your bed. It's a Bible. It's a Bible because this is don't let go of your relationship with the Lord during this time. This is time where your strength is really going to come from Him to stay focused, especially if you're going through like any kind of like, oh, this is just crazy. I can't do this. You know. Remember that you can do all things. Your phone, keep your phone by you in case you need to call Jason, because you need to call for just for encouragement. Keep your phone with you. You don't have to, if people call you, you don't have to answer.
Right.
The tissues, what are the tissues for?
The puddle days.
Exactly. The puddle days. One more thing. No visitors. Keep it, if you need to put a sign at the door, then put a sign at the door. People will understand. It's okay. If you need to just hang it out at a day, it's okay. Okay, don't feel bad. We're going to go through another contraction, then we're going to do some relaxation. Actually, this next contraction is going to be a transition one. And I'm going to want you both to do this one. That's just a couch that rocks the hips.
Just like squeezing hard or just...
Get the coldness as much as you can. Just don't bother with the tiny bits. Is that bearable? Mm-hmm. That actually wasn't too bad. They pulled it
It
out.
was cold. I mean, it hurt.
I
hurt.
It hurt towards the end. It started hurting.
It didn't hurt you?
Not really. Was that...
Too tough.
Do you have a high tolerance of pain?
I do.
Do you?
Yeah. I mean, was that the exercise? Was it supposed to? Like...
Yeah, and it kind of shows you what people do, like how they react to pain. It will tell you because we're going to do another one, the same exercise again, and then we're going to talk about something. But and also, yeah, it kind of shows you like a tolerance of pain, and also like how you react to different things. Like, are you freaking out, or you know? And it's okay. Do whatever you need to do. But it just kind of shows your tolerance of stuff and how. Because we're gonna do one then where I tell you, um, okay, we're almost like halfway. Like, 'cause that was a minute, a little bit more than a minute. We're gonna do one where I say, okay, 30. It's into 30 seconds now. You're like halfway there. Some people like to hear that, and others don't. Because contractions, you can do that, and we can do that too. Like, we're halfway there, and some people are like, okay, I could do this for another, or they don't even want to know where they're at, you know. So that's kind of what we'll look at too. So yeah, I'm just gonna. So, was there any questions at all about anything that or anything we've covered, like throughout? Like, do you feel like you're prepared? Do you feel like you're ready? Like, it's not. I mean, any questions at all? There's nothing you're freaking out about. Nothing. Do you feel prepared? Do you feel like you have?
I mean, people have been asking me, like, are you scared for delivery? Are you nervous? I literally, I mean, when I tell them, I'm just like, well, I feel like birthing classes really do help. Like, I feel like I'm ready.
Good.
It's almost kind of like I'm excited to do this now.
Yeah, exactly. Because you start realizing, oh, my body can do this. Like, I'm gonna experience like the strength that my body has. Yeah, it's gonna be hard, but you know what? With support, we're gonna get through it, and it's gonna be awesome. It's gonna be like, you know, an empowering time, and just gonna be good. Okay, you know what? We're going into another contraction right away. This is transition, and they're getting really close. I'm going to give you another ice. Do the same hand again, just like you did before. Almost there. Okay. Okay. Did that hurt more or less than the last time?
Less for me.
Yeah, maybe.
Interesting. It probably actually was less. What happens when your body's experiencing pain? Your endorphins kick in. The hormone endorphins actually is a painkiller, and it makes it less. Like, it makes the next pain less. Like, your body will have a really hard contraction one time. Your body's gonna be like, "Whoops, that one was a little hard. I'm gonna just give her some more release, and the next one might not. The next one won't be as hard because your body knows what it can handle. So it'll give it an extra surge. Whereas if you get Pitocin, it gives you no let up because it's like it doesn't regulate them. It doesn't say, Pitocin won't say, whoops, that one was a little hard. I'm going to just, but I mean, it just like kind of keeps giving you the same. Where the natural, your body will actually say, yeah, it kind of regulates it, the pain. So I'm not surprised that you're saying that it was a little less that time, just because endorphins kick in and it kind of takes off the edge of it. Another thing, like when you're in labor, we're constantly like, we're going to be asking, we're going to encourage you to change positions. Don't stay in one position real long. Like you'll hear me say, okay, we're going to go through 1 or 2 more contractions, then we're going to get up and we're going to walk around, or we're going to go in the breath ball, like something different. And most times you don't want to get up, you don't want to change positions because it hurts more. But it's really just getting like getting up and moving to another position. It just takes 1 or 2 contractions till you get used to that then too. Like you'll find like if you're like sitting down, like, oh, I don't want to get up, but you do, and I mean, because it really helps. It will help you to go through labor faster. And just keep in mind that okay, once you change positions and you go through like 1 or 2 contractions, you'll be comfortable in that place then too. So don't fight change. Embrace change, knowing that it's good for you, and it's what you're going to need to do to keep things rolling, keep things moving on. So, what did you feel when I said we're almost done with that ice? Was that comforting to you, or did it make a difference?
I don't think it really made much of a difference.
Okay. Jason, did it make a difference for you? It helped you knowing that okay, we're almost done. Yeah. See the difference? Like, isn't that interesting? Yeah. Different personalities, and it's good to know these kinds of things going into labor. It's good to know how you respond to different things. Jody, how do you want to be taken care of? Like when you're sick, like when you're sick and you just really are having an off day. Do you want people to like just love on you and cater to you, or do you just kind of like to be left alone?
What do you mean by cater to?
Like, do you want people to come and like touching you, massaging you, and just being there for you? Or would you rather just be by yourself and just wait it out until you're better?
I think for the most part, just wait it out, just kind of be by yourself, I think.
So you're not big on somebody coming and touching and fussing over you? Right, I kind of thought so. Right. Yeah. That's all good. Neither one is right or wrong. It's personalities, and it's good.
And I think maybe it has to do with the fact that, like, if I am in pain or something, like, instead of distractions doesn't really help.
Okay, you like to
almost feel it more, like, if I'm trying to be distracted. Yeah. But if I just simply, like focus that, this is happening, I just need to kind of, like, I'm just kind of immunize, I can kind of deal with this. I think that's probably how I deal with pain.
Do you think, like, in contractions that you'll want to explore what's going on? Because you're focusing on it, do you want to explore, like, will you explore? Or will you just kind of be like, I'm focusing on just getting through this one?
I mean, if I think about it now, I'm probably going to just say that I'll focus on just getting through it. But I mean, I won't know until it's here.
Right, until you're, yeah.
But I think how it's been, like, I often just have to refer to, like, when I was getting stitches. So that was the last time where I had to deal with, like, pain or whatever. Yeah. And, I simply just had to be like, okay, I don't sit there and look at what's going on. But I just had to just kind of, like, just focus on, like, all right, this hurts, but you just kind of sit there and just...
And you're not trying to distract yourself with other thoughts or, like, looking at something. Interesting, because, yeah, and I know you have brought that up before. And that probably is how you're going to deal with contractions. You're just going to be like, okay, it is what it is, and we're just going to make the best of it, right? It's good to know, because maybe you're one that isn't going to need a whole lot of distractions, because you want to just kind of be left, just wait it out. Yeah, awesome. Okay, we're going to go into a relaxation technique right now, relaxation time right now. So I just want you to sit back and relax. Like, you don't have to be moving around. Just sit back and relax, and I'm going to read a script to you. So just kind of sink. I mean, you can both just kind of like sink into relaxation. I'm going to dim the lights and stuff, and then I'm just going to read. The baby feels your calmness and shares it. The baby is doing just what it should. Your uterus is contracting by itself. Let go. With each contraction, your cervix is dilating a little more. Surrender completely. Your contractions are massaging your baby. Imagine your belly suspended in warm water, floating lightly. Allow it to be pleasurable. Imagine your abdomen separate from the rest of your body. Watch the contractions come and go as if they were slow waves breaking on the shore. Breathe slow and even. Surrender to God. Let your jaw be loose. Let your hands and legs go loose. Let your belly and bottom go loose. Rest deeply between contractions. Your baby will be here soon. You are doing great. The baby will be beautiful. You are strong enough for this. With each contraction, the baby descends a little more. Don't resist. The baby's head fits perfectly into your pelvis. It is all perfect. The hand against your back equalizes the pressure of the baby's head against your back. Pushing the baby out is wonderful work. You can still rest between contractions. Your baby is almost here. Think of coolness. Coolness as the baby's head crowns. Your baby's head is invisible. Feel your baby's round head slip out as you reach down and raise your little one up to your heart. Happy birthday, baby. You can start coming out of relaxation. Just come out slowly. Don't come out of it fast. Just slowly. Celebrate the birth of baby by having a birthday cake.
I never heard that one before. I never heard that one before. Did you write it?
No, I didn't. No,
Where did you find that one?
Rachel. Rachel Thompson.
Okay.
Yeah. Does that turn off now? Don't start going.
Oh, I'll turn it off.
You can turn it off. So how? Well, I'm speaking it off a little bit. Yeah. How did that? Like, what did you feel as I was reading that? Does that help? Like, what happens as we're like relaxing and if I'm reading? Do you concentrate on that, or does your mind just kind of like?
Yeah, you know, try. I think it helps to relax.
I mean, you probably still are kind of want to set everything else out.
Yeah.
Yeah. Mm-hmm. Yeah.
From my side, that's I mean, looking
For
how
you
I look
observing her.
Yeah, for
Yeah.
me observing you.
Mm-hmm.
That's how you would want it. You would just kind of want everything to be quiet. You'll might want people touching you. I don't know.
Well, I'll have my music on. I think.
Right.
Yeah.
If she has music, candles, and
I did
settings
get
just
some
right,
candles too.
she could. Oh yeah, she got the
Some of
flameless.
those.
To take her out to the hospital.
Flameless
Awesome.
candles.
Yeah, that's good. Yeah. And you want good smells, right?
Yeah,
Did you get some scented ones?
I'm very much about like the atmosphere, like the the lighting, and then like the music, and yeah, I did get the diffuser from my dad, so I have that ready.
Okay.
And
Good. The oil diffuser.
Yeah.
Yeah.
The candles aren't scented or anything.
Okay, that's if you have a diffuser, then that will bring a good smell.
Yeah.
And you do like the lavender, don't you?
Yes.
Yeah.
That is by far my favorite.
Yeah.
So that'll be perfect.
Yeah.
And I mean, yeah, if I can have that bath, I know that's gonna
Yeah.
be huge. So
That'll be huge. Yeah.
yeah.
Yeah. Absolutely.
That's why I just cannot imagine having it like in just a hospital, because you can't have that setting there. it just would be.
You mean like without your bath and without
Yeah.
like if you can't like create your own atmosphere.
That's why I'm so big on like a home birth. Like just taking a bath the other night, I was like, this would just be so awesome to have my baby just right here, because I had the lab and I was the lab and I was like, it's crazy, and like, that's what helps me relax.
Right,
Just the
exactly.
atmosphere and like so the smells and stuff. So.
See, okay, now you had checked with birth care and they didn't take your insurance. Is that correct?
Right.
Were they working on like getting that insurance or?
Yeah, she did say they were working on something.
Okay.
So I don't know if it could change by the next time, we decide to have another baby.
Yeah.
So I just know.
Looking at your options.
Yeah.
Seeing what. Yeah.
I just know next time we will be looking into other things. I just haven't had the best experience with,
Right.
intercourse office and the bees there and all that stuff. So I definitely will be looking into. Now I hear great things about women's and babies. I don't think it'll be that. It's just the care.
If you're comfortable with your care provider, you'll be fine there. Is that what you're saying? Yeah. Okay. Good.
And then maybe someone can have him birth.
Yeah. 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 Exactly.
How does it work then? Like if we would go with that lady from Strasbourg, do the nurses work with her then at Women's and Babies?
They do. Mm-hmm. Okay. Yeah. Whatever nurse is on staff would just comes in and just works. So the nurses. Really all the nurses do is come in and look at your stats, like look at your, they really don't, especially if there's a doula there, like the thing with nurses, they have so many people that they're taking care of, they cannot be a constant support. So they're kind of in and out. There's times that they will come and stay for a while and help you through or give you some suggestions, but they cannot, they really can't, they're not staffed enough that they can stay there.
Right.
So they're more concerned about, okay, your blood pressure, your baby's height. They're coming in and looking at the numbers, kind of thing, and recording all that kind of stuff. When it comes closer to the time to birth, then they will some nurses will come in and be there then. But like as far as labor support, there's just too much to do for them to be able to do that. So whoever's on staff when the doctor comes in, like you'll have whoever's on staff, and if their time is up, like their shift is over, they go home, and a new nurse will come in. So you're constantly changing nurses and stuff too. You'll see many different faces. So that's kind of how. That's why people then like doulas, because it's a constant, and it's not like a nurse will come in and your body will always be checking out. Okay, now what nurse is this? Because sometimes you might get one that you don't really like. You're not real comfortable with. And then there's other times that they're awesome, and you're sad to see them go when the shift is over, kind of thing. But it's like they can't, it's not a constant because of, especially at a busy time.
So for this lady, then, she obviously can't have too many clients, because how can she just be available?
The midwife, for a midwife, that's a really good question. A midwife, because they don't really come in until you're about to birth. They can take care of more because they're more come and go as well. But they will make sure they're there to birth. But it's not there when the time being there is not that long.
So it's more just having them for your before care too.
Yes.
Right.
Yes. And making sure that you're comfortable and making sure that they're going to make the right choices. That is huge. The care provider is huge because depending which way they're leaning, they're going to be much quicker to say or try to push on okay, that is it. We're going to do a C-section or something like that. Much more than there's others that say, okay, if this isn't working, let's try this instead of pushing for the interventions right away. So that's why your care provider is hugely important. That they're leaning more toward your best interest and giving you the best experience you can possibly have versus, well, let's just get this over with so I can move on to the next thing, so that's kind of where that's at. Does that answer your question?
Yeah.
Because midwives really don't spend that much time there. Like you said, it's the before and them taking that time with you before. You should be able to have that time. I get bothered when I hear of midwives that don't take time with their patients and don't explain things thoroughly and that you leave being like, okay, this is great. I know, and I trust her. I know that she knows what she's talking about. That's not very cool in my eyes when that's not happening. So because your care provider will come in at some point, and you're going to want to make sure that she's going to have your best interest at heart, and not just that you're not just a number, you know. So, yeah. Okay, let's go celebrate. Thank you, Karen, so
Yes.
much.